Working in a residential behavioral health facility means you are the first line of defense when a client experiences a medical emergency. Anaphylaxis is a severe, rapidly progressing allergic reaction that can strike in minutes, requiring you to actively manage the situation. If you wait for paramedics to arrive before taking action, it could be too late. In a severe reaction, the airway can close completely, making passivity a potentially fatal choice. That's why Amend Healthcare operates on a single, overriding directive for all staff. When in doubt, give the EpiPen and call 911. The physical risk of giving a dose of epinephrine when it wasn't truly needed is minimal. The risk of hesitating when it is needed is lethal. Undertreating a reaction is the only dangerous decision you can make. To know exactly when to act, you have to recognize the difference between a mild, localized allergic reaction, like a few hives or an itchy mouth, and a severe, systemic emergency. Severe symptoms typically manifest across 4 major areas of the body: the respiratory system, the skin, the gastrointestinal tract, and the neurological system. This infographic outlines those 4 key bodily systems. If you observe warning signs lighting up in any 2 discrete areas at the same time, such as sudden, widespread hives combined with respiratory issues like wheezing, that triggers a severe alarm state. Observable symptoms in 2 or more systems definitively indicate anaphylaxis. Keep a close watch on your clients, because mild symptoms can escalate into multi-system failure in just minutes, often with 0 warning. Applying this 2-system rule removes the guesswork from your diagnosis. Instead of panicking, you identify the physical triggers and immediately begin your medical intervention. Once you identify anaphylaxis, you will use an epinephrine autoinjector. This image shows the device alongside its core memory aid: blue to the sky, orange to the thigh. Memorizing this phrase ensures you correctly orient the device and avoid accidentally injecting your own thumb. Step 1. Grasp the injector in a closed fist with the orange tip pointing downwards. Actively keep your thumb and fingers curled tightly away from either end of the device. Step 2. Remove the blue safety release by pulling it straight up. Do not bend or twist the cap, as that can damage the internal firing mechanism. Step 3. Position the orange tip flush against the middle of the client's outer thigh. The needle is specifically designed to penetrate clothing, so do not waste time removing their pants. Step 4. Swing your arm back slightly and push it firmly into the thigh at a 90-degree angle. You will hear and feel a loud click when the deployment mechanism triggers. Step 5. Hold the activated device tightly against the leg for a strict 3-second count. Count it out loud: 1 1000, 2 1000, 3 1000. Executing this specific sequence guarantees the life-saving medication enters the client's deep muscle tissue, while fully protecting you from accidental injury. Successful intervention requires moving beyond the physical injection to navigate facility protocols and client rights during a crisis. If a client is conscious and exhibiting symptoms in multiple body systems, quickly explain what is happening and secure verbal consent before you administer their prescribed EpiPen. If the client becomes unresponsive, confused, or physically is unable to answer, the emergency doctrine of implied consent applies. Bypass verbal permission completely and administer the medication to save their life. If a client in anaphylaxis does not have a prescribed personal device on hand, immediately grab the facility's stock EpiPen located in the emergency kit and use it. Sometimes a conscious client will actively refuse treatment. If this happens, verbally explain the extreme danger they are in, document their refusal, and call 911 regardless of their wishes. You must never physically force an injection on a refusing client. However, you maintain continuous monitoring. The exact moment they lose consciousness, implied consent activates, and you intervene to administer the dose. While client rights are always respected, you maintain a state of absolute readiness. You stand by to intervene the precise moment a medical emergency overrides the client's ability to choose. After the injection, carefully lay the client flat on their back and elevate their legs to prevent cardiovascular collapse. If they are vomiting or struggling to breathe, immediately turn them onto their side. This graph charts symptom severity over time to illustrate a biphasic reaction. You see the initial severe spike, followed by a drop back to baseline as the client recovers. A secondary spike can occur up to 72 hours later, completely without a new allergen exposure. Resolving symptoms do not mean the client is safe. Because epinephrine wears off in 10 to 20 minutes, this delayed secondary reaction is why every administration mandates an EMS transport to the hospital. When paramedics arrive, hand over the exhausted device, provide the client's full medication list, report the exact time the dose was given, and identify the suspected allergen. Survival against secondary reactions depends on both the injection and the subsequent data handoff to emergency responders. Navigating an anaphylaxis response requires you to identify symptoms across 2 body systems, quickly secure verbal or implied consent, and confidently execute the 5-step injection process. Your responsibilities extend to prevention as well. Inspect your facility's emergency kits every month, actively checking for expired devices or viewing windows that show cloudy medication. Following an injection, prioritize continuous 1-to-1 monitoring and keep the client properly positioned until EMS takes over the scene. As direct care staff, you hold a life-saving tool. If you face any uncertainty regarding an allergic reaction, default to action, give the EpiPen, and call 911.